real on menopause. So it's time to bust some myths and reveal some truths about this stage in life. I'm going to read some menopause quote-unquote facts, and I want you to tell me if it's true or if it's false. And then, Dr. Dixon, you're going to be the final authority. You're going to reveal the truth, okay? So this is for you too, audience. Here's the first one. Women in menopause can still get pregnant. True or false? I want it to be false, but I think it's true. Because, Lord, I do not need a pregnancy. Come on, not right now. They're old enough now to have a baby now. Is it true or false?
Oh, my word.
What? I thought menopause.
Well, the question was menopause.
Okay.
Remember,
okay.
12
All
months,
right.
no periods. You're not shooting eggs. Sperm
Who
has
else
nothing to do.
answers the same as me because I feel dumb? Anyone else? Okay, good. I'm not alone. I'm not alone.
They're allowed.
Menopause will make you gain weight. Is that true or false? I'm going to say it's not an automatic thing. They're all saying true. You guys all say half true, half false. What is it, Doc? It's false.
It's not automatic.
Give us some info on that.
It's not automatic. It's also because, you know, we're a little bit older. We have other things going on. Sometimes we have medical comorbidities, so we are not able to be as active as we want to be. And it's sort of, estrogen goes away. You have a little bit like the college freshman 15. Like if you don't have good habits, you need to establish them now.
Oh, now's the time. Now's the time.
Proactive.
Eat like Marilyn.
Eat like Marilyn.
Fiber, fiber, fiber. Yes, Mare. Okay, menopause symptoms last for 10 years. True or false? Some true. I like that you said it. Yeah, she's standing by it. A lot of falses and some true. False.
Yeah, false. Last was
Why are doing this show?
It's informational. My grandma loved her estrogen gel until the day she died.
Okay.
She was attached to it. I was like, you have to get off it.
So no symptoms?
No, she felt kind of edgy without the Permin gel. She would put that stuff on everything.
Yeah.
I loved her.
I want your grandma's gel. That's good. Okay, how about this? No periods means no cramps. True or false? I'm going to say
100%
false.
I'm
but I'm
waffling.
actually not even sure.
I'm not
the
sure.
The audience is mostly false.
I'm not sure.
Janice, why do you say false?
Because I feel like, you know, maybe they're like, I'm going with counter logic, actually.
Yeah,
That's not my answer.
Right? I don't know.
I'm just trying to win.
No, that's the spirit. Doc, what is it?
Sorry. Of course you can get cramps.
You can get cramps.
You
with
get
no
cramps.
period.
They're not premenstrual cramps, but you still have your bits and pieces. Like stuff can happen.
Right.
And so you actually need to still be aware of what's going on in your pelvis, because if something feels different, you need to get it assessed.
Marilyn's scared.
Mostly nothing happens, but you can have cramps.
How about this one? There is no relief for hot flashes. This best be false. There is no relief for hot flashes. Most of you are saying false. Some of you are saying true. Okay, so we all agree with false. I'm saying false because I need some hope. What's the answer?
You're welcome.
Yeah.
What treatments are there for hot flashes, though?
So sometimes it's hormone therapy in the short term. There are also medications that we traditionally use for anxiety and depression. Effexor, that can be helpful during the time. And then, you know, dress in layers, water wicking pajamas, have a fan with a remote control, hit it when you need it, get away from people who annoy you.
Yes.
Yes. Avoid the
There's some people that will not be able to go to work with that advice.
It's like Dr. Dixon gave me a free pass.
I gotta go. I need a doctor's note. Okay, women in menopause have to pee all the time. I'm going with false.
I'm going with false.
Some trues out there, but a lot of falses. Kathy, why do you say false?
You
don't want to believe that's true.
My intuition tells me. I don't think I noticed that terribly.
No, you didn't have that.
Don't think so.
What is it, Doc?
No, it's false. You don't. Some people do need to pee a lot.
Yeah.
And it depends.
Yeah.
So if people have had a lot of vaginal deliveries and then menopause happens, they could end up every time they cough, they sneeze, they run.
Yeah.
They can leak.
Right.
But it's not like you're peeing more frequently. And if you're a frequent peer, you can train your bladder.
How do you train your bladder?
Marilyn knows.
I know.
What do you do?
Well, you just practice.
You practice what? just holding it?
No, so some people like a bathroom. They like, I think they just want to see the bathrooms in the different places they go. So they end up emptying lots.
Yeah.
And their bladder doesn't get used to being full. When you're a surgeon like me and you have to do surgery for an hour, 2 hours at a time, you have to be like a camel. You got to squeeze and hold.
I've heard both of those things, though. I've heard it's not good to hold your pee too much, but I've also heard, like Bryce said, if you're sleeping and you have to go pee, don't wake up to pee. Try and make it go away and have your sleep, because your sleep's more important than that pee.
Oh, but Bryce, if I got to pee, I'm not going to pee my bed.
No.
No, he says you can train yourself to not do it. And honestly, I've done it a couple of times, and then the annoyance of the pee goes away, and I end up having a good sleep. But if I had gone pee and gone back to bed, I would have been up for the rest of the night.
Well, so training also involves making certain smart decisions about peeing. So, you know, stop drinking at 7 o'clock, don't have coffee, stay away from caffeine, those kinds of things. So it's like
all right. From menopause to pee, I don't know how we got here. Okay. So, menopause makes you sleep better. Is it true or false, everyone?
There's not a true thing. Come on, everybody's false.
Everybody got this one right.
Yeah.
Yay.
But why?
We can all talk at 4 a.m.
Why does it make you sleep worse?
It does. It's not so much that it makes you sleep worse, but often women have hot flushes at nighttime.
Yeah.
And night sweats.
Yeah.
The water wicking pajamas are key.
Yes.
Because then you have this big sweat, and you're like, oh God, I'm so cold. And you're like, I'm gonna take off my pajamas, and you're awake.
Yeah.
And then you have like uninterrupted sleep is a beautiful thing that many women postmenopausally don't experience.
Okay, back to my pee theory. Just checking. That was very good. Good information. It's time for a short break. We'll be right back. That's why you have to hold it.